In this episode, I'll be discussing the negative side effects of an osteoporosis drug named Fosamax, as well as a series of type 2 diabetes medications, one named Januvia. Fosamax is supposed to prevent age-related bone damage. Instead, people who've taken the drug have suffered from a wide range of side effects, including femur fractures, jaw necrosis, and esophageal ulcers. For many people, one of the many worries that comes with getting older is the risk of developing osteoporosis. This debilitating disease makes bones so brittle they very easily break. Now, when Fosamax was introduced in '95, it was promoted as the solution to osteoporosis and other bone-damaging diseases. Instead, studies have proven that Fosamax causes a slew of severe side effects that may be more problematic than osteoporosis itself. Furthermore, the Food and Drug Administration documented several of the drug's side effects and subsequently distributed numerous warnings. Apparently, Fosamax belongs to a series of drugs, which is well known to cause many of the drug's side effects, all ranging from mild to severe. Now, according to Merck, the drug's manufacturer, the most common side effects include gastrointestinal issues, such as nausea, diarrhea, constipation, and cramping, and it can also cause skin rashes and eye problems. However, those are not the severe side effects. According to Merck, a defendant in litigation because of Fosamax mentioned that the more severe side effects include broken bones, jaw deterioration, esophageal problems, low blood calcium, and extreme bone and joint pain. Now, for those taking Fosamax, it's been noted that maybe the most frustrating side effect is the drug's propensity to cause fractures of what is one of the strongest bones in the body, the femur. These low-energy fractures, also called stress fractures, often happen when patients least expect it. Some patients reported breaking bones while they were doing normal everyday tasks, such as walking or sitting. Now, Merck said that the fractures usually come after weeks or months of groin and hip pain. And researchers are still trying to determine why Fosamax is linked to bone breaks, especially bone breaks in patients taking the drug for a series of years, around 4 to 5 years. Now, many scientists have theorized the drug shuts down the body's bone renewing process and creates more brittle bones. Now, another alarming side effect of Fosamax is jaw osteonecrosis, also called dead jaw syndrome. This happens when the blood flow to the jawbone or mandible is cut off and causes bone death, usually onset following minor trauma such as dental work, jaw necrosis, or aka cell death, which causes an antibiotic-resistant infection as well as swelling. Now, this infection eventually takes over the tissue and causes bone to die and collapse. Many other Fosamax patients have developed esophageal issues, such as irritation within the esophagus, inflammation, and bleeding ulcers within the esophagus. Now, the esophagus is the tube that connects the mouth to the stomach. Recent studies point to these problems leading to esophageal cancer. Those who have pre-existing known upper gastrointestinal problems have been recommended not to take Fosamax. In some patients, Fosamax has been proven to lead to esophageal erosion, accompanied with bleeding and esophageal perforation. Because of these potentially dangerous side effects, Merck and Company recommends that patients sit upright or stand for a full 30 minutes after taking the drug. Oh, and make sure you take it with a full glass of water. Fosamax is also been linked to low blood calcium. And low blood calcium levels can lead to hand and feet spasms, muscle cramps, and abdominal cramps. Now, since Fosamax and the family of drugs Fosamax belongs in hinders the natural breakdown of bone, less calcium is deposited back into the bloodstream. And as the tissues and cells are robbed of calcium, patients can suffer from soft bones, nausea, fatigue, and muscle weakness. And these side effects can also cause other side effects, leading to spasmodic movements and seizures. Recent FDA studies have also found that Fosamax can cause musculoskeletal pain. This is where patients can develop severe bone, muscle, and joint pains within days of starting the drug. And for many patients, this pain is so immediate and so intense that doctors treat it simply by prescribing powerful pain medicines. And that is a best case scenario with regard to how a doctor may respond to this musculoskeletal pain. There have been cases where the doctor simply ignored the patients. Now I would like to discuss the cancer-causing type 2 diabetes drugs. Januvia, Janumet, Byetta, and Victoza. These prescription drugs, Januvia, Janumet, Byetta, and Victoza, are popular type 2 diabetes treatments. But reports of dangerous side effects, including pancreatitis and pancreatic cancer, have raised serious questions about whether the drug's risks outweigh their benefits. And many people who have suffered from these side effects have rightfully so filed lawsuits against the makers of these drugs. And because of these revelations, it's also been said that this may profoundly affect the way doctors choose to treat the 25 million Americans suffering with type 2 diabetes. According to a study published on February 25th, 2013, in the JAMA Internal Medicine Journal, patients taking Januvia or Byetta were twice as likely as those who took other drugs to end up in the hospital with pancreatitis. That is, inflammation of the pancreas, which can be fatal. Research found that the inflammation results from pancreatic lesions caused by the drugs. Now, this seriously concerns doctors because pancreatitis can lead to additional serious problems, such as pancreatic cancer as well as kidney failure. Now, Januvia, which is an oral medication, and Byetta, an injectable medication, both increase amounts of GLP-1, which is a hormone in the body that stimulates the pancreas to produce insulin. In addition to insulin, the pancreas also produces digestive enzymes. And if these enzymes are activated before leaving the pancreas, they can actually digest the tissue of the organ, causing inflammation, abdominal pain, fever, and nausea. The findings of the study have doctors calling for more research into how GLP-1 drugs work in the body. In a recent statement, the study's author, Dr. Sonal Singh, said, quote, "This is the first real study to give an estimate of what the risk is. Until now, we just had a few case reports." We really need to know more about these drugs, as pancreatitis is on the pathway to pancreatic cancer. Unquote. Other doctors like Aaron Cyprus of the Joslin Diabetes Center in Boston have said that the results of the study will not change how he treats his patients. Cyprus told Reuters, quote, "For me personally, it's not going to change my practice pattern in terms of stopping the drugs, but we may revisit whether you're showing any of the risk factors." Unquote. Pancreatitis currently affects about 3 in 1,000 diabetes patients. The new study indicates that the number jumps to 6 in 1,000 for patients taking Januvia or Byetta. That would be a 100% increase. Now, according to Merck and Bristol-Myers, they maintain that their drugs, Januvia and Janumit, are safe and effective. According to the company, it has reviewed preclinical post-marketing safety data and told Bloomberg that it found no compelling evidence of a causal relationship between their drug, pancreatitis, and pancreatic cancer. Now, looking back at the Vioxx lawsuit, the NuvaRing lawsuit, and currently the Propecia lawsuit, that is a standard run-of-the-mill response whenever a pharmaceutical company comes under fire after releasing a dangerous and potentially lethal medication that they had originally advertised as benign, aside from the positive effects of the drug. But I digress. And to further add insult to injury, a pharmaceutical spokeswoman added that the company takes the safety of its medicines as well as the patients who take them very seriously. Now, despite the company's insistence on the drug's safety, a number of lawsuits have been filed against both Merck as well as Bristol-Myers, which bought Amylin, which is Byetta's original manufacturer, in and around 2012. And according to the Food and Drug Administration, data compiled by the Institute of Safe Medication Practices show that there are hundreds of reports of acute and chronic pancreatitis attributed to Januvia and Byetta in 2011. People who took these drugs and were diagnosed with pancreatitis and pancreatic cancer filed lawsuits against the drug makers. One such person is a woman by the name of Kathleen Riley. She was diagnosed with pancreatic cancer after taking Januvia and Byetta to treat her type 2 diabetes and died as a result of the disease. Some may say she was murdered. Now, her heir, Guy Riley, filed a lawsuit against Merck and Amylin, now known as Bristol-Myers. The lawsuit claims that Merck and Amylin failed to warn patients of the risks and marketed the drug even when they knew the risks, deliberately endangering the lives of their patients. It's no surprise that more lawsuits are expected to be filed as reports of complications rise. Now, for those of you taking Fosamax or any of these type 2 diabetes medications, may be urged to speak to their doctors, to bring up this information with your doctor, because the most important thing is your health. Now, I'd like to thank you for listening to episode 3 of Warlike Art, and I'd like to ask you to stay tuned for episode 4. And for those of you needlessly suffering due to the negative side effects of pharmaceuticals deemed FDA safe and touted by the pharmaceutical companies as benign aside from the positive effects of the drug. Again, I would like to state that you are honored for your strength to carry forward, that you are loved, and to stay strong.